Thank you. So as you said, I'm going to be talking about research evidence and how it was or perhaps was not used by legislatures as they developed policies to implement publicly funded syringe exchange programs. And before I go further, I also have to acknowledge the contributions of my co-authors, Monica Ruiz and Allison O'Rourke, who are also in the audience. If we have follow-up questions that I can't answer, I will defer to them. So this study, as we all know, syringe exchange programs are highly effective in preventing HIV transmission. They're effective in linking injection drug users to other health and human services, such as housing assistance, mental health services. I'm really preaching to the choir here, so I will not go further. Syringe exchange programs are awesome. But what we don't really know a whole lot about is how research evidence has been used to shape policy for their funding. So as you see on the screen, research objective, examine the role of research evidence in shaping the policy for the implementation of publicly funded syringe exchange programs in 3 U.S. cities. Those are Baltimore, Maryland, Washington, D.C., and Philadelphia, Pennsylvania. In conducting this study, we reviewed the existing literature on research evidence applications as well as policy reform. Research evidence, kind of everything related to policy reform. There are lots and lots of things out there on research evidence, and for brevity, we will only talk about 3 today. These 3 were selected based on inductive examination of the interviews, and those are instrumental use, that's when research evidence gives direction to policy. Conceptual use, that refers to when research evidence serves to change how a problem is understood and addressed. And lastly, symbolic use, and this is when research evidence justifies actions that have already been taken. The methodological approach was qualitative. We conducted 29 in-depth semi-structured interviews with policy stakeholders. These included senators, community stakeholders, and representatives from each of the cities. Stakeholders were identified through historical records, through voting records, and also through respondent-driven sampling. All completed interviews were transcribed verbatim, and we had 2 qualitative coders analyze the data. In the analysis, we were looking for any mention of research evidence. We define this as any mention of empirical studies related to syringe exchange programs, any data that played a role in shaping, driving policy change, any mention of persons using or not using research evidence, or any mentions or discussions of how stakeholders employed research evidence to argue in favor of or against of syringe exchange program implementation. The results, this table summarizes the participation rates. The interesting thing on this table is you will see not many people in the opposition wanted to talk to us. That's not really surprising now, is it? Because we're researchers and most of the opposition, they don't really like using research evidence. This table summarizes the demographic characteristics of those who participated. As you'll see, the majority identified as male, as Caucasian, and the majority identified as policymakers. In the Baltimore city context, Baltimore primarily used research evidence in an instrumental manner to directly facilitate and guide policy change. And all of these interviews, research evidence was discussed in terms of research evidence champions who talked to the legislator, they talked to the community, and it really was a reliance on research evidence in those discussions. And these quotes capture the essence of the instrumental use of research evidence. The Philadelphia city context, I think this is the most interesting for me. Research evidence was applied symbolically and conceptually. The symbolic application followed after activists basically saw that politicians were not going to follow the research evidence, and they decided to create their own syringe exchange program and operate it illegally. So after they created Prevention Point Philadelphia, all of the controversy, they pointed to the research evidence to justify their actions. Conceptually, they also used research evidence to convince the people that what they were doing was correct. So conceptual use is when you change how the problem is understood. So before this, everyone understood injection drug use in terms of fear-mongering, kind of the standard stigma attached to injection drug use. So the activists went to the people to change that. And they knew that if they changed that idea among the people, then the people would pressure the legislator and obviously secure policy change. Washington, D.C., this is the city that I currently live in, and I affectionately refer to it as the political walrus in the room. D.C. is not a state. It does not have control over its own budget. Congress does. And as such, you can imagine that if your political leaders do not have to answer to the population, then all of their votes are free votes. In other words, they don't have to answer to the fallout from whatever they vote on. Research evidence was not very successfully applied in the DC context because of this, just because, frankly, a lot of legislators just didn't give a damn about research evidence. It was all on political, ideological lines, partisan politics. There was just no really latitude in how they wanted to respond. And these quotes obviously capture that. Conclusion, Baltimore used research evidence in an instrumental fashion to drive policy change. Philadelphia used research evidence conceptually and symbolically. And research evidence, as I said, played a minor role in DC because of the nature of DC being a non-state and also partisan politics driving all of the discussions. A recurring theme throughout all of the cities was data-free zones. This just refers to when research evidence did not matter, or when people were against syringe exchange programs because of their own fears and their own concerns, and these fears and concerns were not based in science. So people were saying that syringe exchange programs would increase crime, they would increase drug use, they would increase the number of discarded syringes on the street, and as we all know, that's completely false. We have evidence to the contrary. Future applications of research evidence. Applications of research evidence to policy change processes may facilitate policy reform discussions, but their efficacy falls short when policymakers ignore the merits of scientific research. I feel like that's a big duh for everyone in this room, but it's good to say it, just have it on the record yet again. Advocates for policy interventions for HIV prevention may benefit from understanding the applications of research evidence. When I think of recommendations for future work, I think of if your political leaders don't want to listen to you, then go conceptual and get your people on board. Have them apply the pressure to the politicians to make them understand. Or if you're so willing, go symbolically, do the syringe exchange on your own, and then use the research evidence to justify why maybe you should not be put in jail. Acknowledgements, I should say. NIDA for funding, the District of Columbia Developmental Center for AIDS Research, obviously all the participants in the qualitative work, Prevention Point Philadelphia, the Baltimore City Needle Exchange, and Prevention Works and the DC Needle Exchange. And also 2 of our collaborators who worked with the study. And that's it. Thanks.